So the first thing you're going to want to do is review your patient's health record, make sure everything's prescribed properly. Then you're going to perform hand hygiene and put on some PPE, which right now all we need is some gloves. You're going to identify your patient, name, date of birth, allergies. You're going to ask them if they're in need of any pain medicine and make sure they understand what's happening. You're going to go ahead and remove the old bandage from the outside around the edges so that you're not pulling anything. If anything gets stuck and seems like it's having some pain, you can use some saline to get it loosened. You're going to go ahead and carefully remove the dressing. When you do remove the dressing, you're going to note any presence, type, color, odor, drainage on that soiled dressing. Throw it away, change your gloves, perform hand hygiene. Then you're going to inspect your wound, make sure everything looks as it should. If you note anything, any of the drainage, the edges, chart that. You're going to bring all of your supplies over to bedside and get everything set up. Go ahead and open everything so that your sterile field gets open and ready to go. You're going to open everything over from the side of where you're setting up. You're going to find the edge of your sterile drape, let it fall open, open it. When you're setting all of this stuff up, you want to make sure you don't cross your own body, cross your arms, cross over the actual field you're setting up. Ideally, I would have been able to use a larger table because you don't want your inch edges to be hanging over. And I do address that. When you get your saline into your thing, you always want to cup your label, lip it into the trash. Make sure that that's good. You want to never pour over your sterile field because if it drips, then it's not sterile any longer. Every time you open a sterile package, you want to make sure you're presenting that to your field so that nothing of the dust that's on the package itself is falling on there. So always presenting, you kind of want to focus on never letting your hands drop below your waistline. So sometimes you just drop things into the trash can. That's why it's really important for that to be there. So you're opening all of your things that you need for assessing your wound and redressing your wound. And right here is where I point out that's 1-inch border. You also want to take a piece of tape or your actual piece that you're going to use, and you're going to want to name it, date it, and time it for when you're going to place it on your patient. Next thing you're going to go ahead, now that your sterile field's set up, you're going to go ahead and put your sterile gloves on. You're going to open that package. You're going to take note to unfold it properly. You have a little lip to open because, again, everything in that 1-inch around the edge is no longer sterile. So you're going to grab the inside of the glove, slide that on your dominant hand. Then you can slide your hand into the cuff onto the actual sterile side, pop that piece open, and slide it onto your second glove. When I get my sterile gloves on, I like to cross my fingers so that I'm very aware. So from here, you're going to start in on cleaning the wound. You're going to go from center, swipe from top to bottom. When you drain, you kind of make sure that you're not leaking any of it. So you want to wring it out and kind of make a puff ball so that your actual hands aren't touching the wound, top to bottom, inside to outside. Once it's clean, you're going to grab a piece of sterile gauze and you're going to dab along the outside of each side to dry it. Once it's dry, you're going to take a Q-tip. You want to wet it just to make sure. You can check for tunneling here, check for how deep it is. If you need to measure, you can take note of that. Once you're done measuring, you're going to go ahead and get another piece of wet gauze. You're going to open it up, and I like to draw it into my hand so that I have track of it. I'm going to grab my other Q-tip, and I'm ready. I'm ready to pack my wound here. So I'm just going to go ahead and pack that gauze in using the Q-tip so that I don't actually have to touch the patient's wound itself. And I want to make sure that that fits in there nicely. If it didn't fit, I would go ahead and cut off any excess. Then I'll go back to my sterile field. I'll grab my 2 other pieces of dry gauze and I lay that lightly over. Then I'll grab my top bandages and get those ready to go for my patient. Anytime I'm working on the patient, and also because of my sterile field, I always want to keep that in my peripheral vision. I never want to turn my back to my field. Now that my top piece is on of my touch my patient, I'm no longer sterile. I'm going to take that piece of tape and throw it over my patient so they're good to go. I can clean up my site, take off my gloves, perform hand hygiene, and I'm all good and done.
Don't forget to chart everything.